Welcome to the deep dive. Today we're looking into something that sounds, well, pretty frightening. Sudden hearing loss.
Hmm.
Imagine sound just fading away or disappearing completely in one ear, out of the blue. It's definitely a scary thought.
Absolutely.
And if you, or maybe someone you know, has actually gone through this, you're probably wanting clear, reliable information about treatments and, wanting it quickly.
That's exactly what we're aiming for today.
Mhm.
We're going to take a close look at one potential treatment, hyperbaric oxygen therapy,
Okay.
specifically for what doctors call idiopathic sudden sensorineural hearing loss.
Right? That's a mouthful.
It is, isn't it? But
Yeah.
it basically just means a sudden loss of hearing where the cause isn't immediately obvious and it originates in the inner ear of the nerve pathway.
Got it. So unexplained inner ear hearing loss.
Precisely. And we've pulled together information from various places, European medical guidelines, some handbooks on hyperbaric medicine, and several scientific articles to really try and break this down.
Okay, sounds good. So let's start with the basics then. Hyperbaric oxygen therapy. What actually is it? It sounds quite high tech.
Well, at its core, the idea is actually pretty simple. It involves having a person breathe pure 100% oxygen
Okay.
while they're inside a specially designed chamber where the air pressure is increased quite significantly above normal levels.
So higher pressure, pure oxygen, like diving almost.
Sort of, yeah. Think of it like being maybe 10 or 20 feet underwater, pressure-wise, but breathing pure oxygen instead of compressed air. This increased pressure allows your lungs to absorb, well, much more oxygen than they normally would just breathing air at sea level.
Right, so you're packing more oxygen into the system. What happens then? Where does it go?
Exactly. All that extra oxygen gets dissolved directly into the liquid part of your blood, the plasma.
Ah, okay. Not just carried by red blood cells.
Well, the red cells get fully saturated very quickly, but the high pressure forces much more oxygen directly into the plasma itself. And the fascinating part is this super-oxygenated plasma can then travel throughout your body and deliver oxygen to tissues, even those where blood flow might be, shall we say, a bit sluggish or compromised.
I see. So it's like an express delivery system for oxygen, even getting to hard-to-reach places.
That's a good way to put it, yeah.
And this is where the connection to sudden hearing loss comes in, I guess. The idea being the inner ear might be one of those places that isn't getting enough oxygen.
That's precisely the rationale.
Yeah.
The main hope behind using hyperbaric oxygen for this kind of hearing loss is that this boost of oxygen can reach those really delicate sensory cells deep inside the inner ear, the hair cells that are responsible for detecting sound.
Okay.
If those cells suddenly stop working properly, one possible reason, among others, is that their oxygen supply has somehow been reduced or cut off.
So the therapy aims to kind of flood the area with oxygen and help those cells recover.
That's the fundamental goal, yes. Increase the oxygen supply to hopefully support cell survival and function.
It makes sense logically. I remember reading something maybe about eye conditions where they mentioned the fluid inside the eye could act like a little oxygen reservoir after this therapy. Is it anything similar thought to happen with the ear?
That's an interesting point about the eye.
Hmm.
And yeah, the vitreous humor can hold oxygen. For the ear, it's less about a specific fluid reservoir like that, but there are other potential mechanisms being explored.
Like what?
Well, some research suggests that hyperbaric oxygen might encourage the body to release something called tissue plasminogen activator, or TPA.
Ah, the clotbuster drug?
Sort of, yeah, the body makes its own version. And TPA helps break down tiny blood clots and can improve blood flow in small vessels, what we call reperfusion.
I see. So even if it's not a major blockage, maybe improving the microcirculation in the inner ear could be beneficial.
Potentially, yes. It's another way that therapy might help restore normal function, beyond just direct oxygen delivery.
Okay, this is all sounding quite plausible, but the big question is always, what does the actual evidence show? Are there solid studies demonstrating that this therapy really helps people get their hearing back?
Right, the evidence. It's an area of ongoing research, and the picture isn't perfectly clear, honestly. There was, for instance, a study out of Japan that surveyed how hyperbaric oxygen was used for sudden deafness. It was quite large, looking at 907 years.
Wow, okay.
But the thing is, while a big survey like that tells us how doctors are using the therapy and what they're reporting, it didn't have a comparison group, a control group.
Ah, so you can't be sure the oxygen therapy caused any improvement. It might have happened anyway.
Exactly. People can sometimes recover from sudden hearing loss spontaneously. So that study is more about observing practice patterns rather than proving effectiveness.
Right, right. Useful context, but not proof. What about studies with better designs, clinical trials.
Yes, there have been some.
Hmm.
One study involved 21 patients who had suffered sudden hearing loss really recently, like within 12 hours of onset. And I made sure to exclude people where the cause was thought to be inflammation of the blood vessels, something called arteritis.
Okay, so a specific group treated early, what did they do?
These patients got a pretty intensive hyperbaric protocol, 3 sessions within the first 24 hours,
Wow.
then twice a day for up to 2 more days. And the pressure used was 2.4 times normal atmospheric pressure.
Did their hearing improve significantly compared to, say, standard treatment?
Well, the source material actually highlights an interesting side note for that study. About 10% of the patients regained enough visual acuity to allow reading again.
Visual acuity, not hearing.
Correct. Now, obviously, we're talking about hearing loss, but this detail is mentioned, perhaps suggesting the therapy given early and intensively might have some broader positive effects on sensory tissues under stress.
That's interesting. But yeah, very indirect for hearing loss itself. We need to be careful not to jump to conclusions there.
Absolutely.
Yeah.
You can't directly translate improvement in one sensory system to another. The mechanisms, the tissues involved, they can be quite different.
You also mentioned a more recent study, but it was focused on stroke. How does that fit in?
Right. That was a study looking at acute ischemic stroke where a blood clot blocks flow to the brain. They used hyperbaric oxygen at 2.5 atmospheres for an hour and compared it against a sham treatment, which was just slightly increased pressure, like 1.14 atmospheres, to mimic the feeling without the therapeutic effect.
Okay, a proper control group.
Yes. And while the focus was stroke, this kind of research is still relevant because it helps us understand the safety and, frankly, the feasibility of using hyperbaric oxygen for acute conditions where tissues are starved of oxygen.
So testing the waters for emergency use, basically.
Pretty much. It explores if we can safely administer it quickly in urgent situations. But importantly, just because a therapy might work or not work, for stroke doesn't automatically mean the same for hearing loss. They're different beasts.
So what did that stroke study find? Did it help?
Actually, no. That particular stroke study did not show a benefit from the hyperbaric oxygen. In fact, it raised some questions about potential harm in that specific context.
Oh.
But again, and this is really crucial, stroke involves brain tissue, different mechanisms, maybe different timing issues compared to sudden hearing loss affecting the inner ear.
Right.
What that study really underscores, though, is how vital well-designed trials with proper control groups are. And it also highlights that the details matter immensely. The exact pressure, the duration, how soon you start treatment, all these things could be critical.
That makes sense. Getting the dose right, so to speak. Speaking of how it's delivered, these hyperbaric chambers, they sound like serious pieces of medical equipment. What about the safety and operational side of things?
Oh, absolutely. Safety is paramount. These aren't just walk-in clinics. You generally find two main types of facilities.
Okay.
Some are based right inside hospitals. These often have 247 support and are equipped to handle pretty serious medical emergencies, even inside the chamber itself.
Right, full critical care capabilities.
Exactly. Then you have freestanding centers. These usually operate more on a scheduled basis for patients whose conditions aren't immediate emergencies, but they must have solid links and transfer plans with a nearby hospital, just in case.
Makes sense.
And there are even transportable chambers, maybe for specific situations, but they all need to follow really strict safety rules.
So what kind of rules are we talking about? What are the big safety must-haves?
Well, comprehensive emergency operating procedures are absolutely critical. Think about it. Dealing with a medical emergency is complex enough, but doing it inside a sealed, pressurized metal tube adds whole layers of difficulty.
Yeah, I can imagine.
So facilities need really clear, well-understood plans for all sorts of potential scenarios, and these procedures need to be practiced regularly. The European Code of Good Practice we mentioned actually dedicates a whole section just to outlining what needs to be covered in these emergency plans.
Sounds thorough. What else is key for safety, besides emergency plans?
Just the day-to-day maintenance of the chamber and all its systems. It's non-negotiable. There needs to be a detailed maintenance log tracking what's done, when any problems found, how they were fixed.
Following the manufacturer's instructions, I assume?
Absolutely. That's the baseline. And you also need specialist technical staff running the show. People who understand, high-pressure gas systems, pneumatics, dieting physiology, the specific technology of hyperbaric chambers. It's a specialized field.
Definitely sounds like it. It's not just the equipment safety, though, is it? What about risks for the person actually in the chamber?
That's right. There are potential physiological effects too. The pressure changes themselves can cause issues, what's known as barotrauma.
Like ear pain when flying.
Exactly, that's a mild form. It can affect ears, sinuses, any air-filled space. It can also affect certain medical devices someone might have.
Okay.
And because you're dealing with 100% oxygen under pressure, fire risk is a serious consideration. It's crucial that the oxygen breathed is clean and delivered through a proper mask or hood system.
Right. Minimize any ignition sources.
Precisely. Most modern chambers have automatic systems to quickly vent the oxygen if a fire is detected. And they might have specialized water mist fire extinguishers inside as well, just in case.
Any other risks? You mentioned the high oxygen levels.
Yeah, breathing oxygen at very high pressures for extended periods can potentially lead to oxygen toxicity, affecting either the lungs or the central nervous system. Now, the sources we looked at for this application for hearing loss didn't delve deeply into toxicity issues in this context, but it's a known potential side effect of hyperbaric therapy in general that needs careful management through appropriate treatment protocols.
Okay. You've mentioned this European Code of Good Practice a couple of times. Can you tell us a bit more about what that is?
Sure, it's basically a set of comprehensive guidelines developed over time through a big collaborative effort. It involved medical experts and diving technology specialists from across Europe.
And its purpose.
Its main goal is really to ensure that hyperbaric oxygen therapy is delivered safely and effectively. It sets standards for the equipment, how facilities should operate, and importantly, it defines the roles and the required training for all the staff involved, doctors, nurses, technicians.
So promoting a high, consistent standard of care across different centers.
Exactly. It's all about patient safety and making the best use of this specialized therapy.
Okay, so let's try and pull this all together. Based on everything we've dug into, what are the main takeaways about hyperbaric oxygen therapy for sudden hearing loss?
Well, to sum it up, the core idea is that hyperbaric oxygen therapy boosts oxygen delivery, potentially reaching the inner ear. And yes, it has been looked at as a possible treatment for idiopathic sudden sensorineural hearing loss. Some studies, particularly those where treatment started very quickly after the hearing loss occurred, seem to suggest there might be some benefit. The theory is sound, get more oxygen to those struggling cells, maybe improve blood flow too. But, and it's a significant but, the overall evidence isn't yet conclusive. We don't have a really strong body of definitive proof specifically for this condition. More high-quality research, especially larger, well-controlled trials, is definitely needed.
Right. We need to figure out more clearly how effective it really is, who it helps the most, and what the absolute best way to administer it is: the timing, the pressure, the number of sessions.
Precisely. So while there's potential and some positive signals in early treatment scenarios, we're still waiting for that really robust evidence to guide practice confidently for everyone.
Okay. That definitely gives a much clearer, albeit complex picture. Thanks. So to wrap up our deep dive today, what's maybe one final thought or question you think our listeners should mull over after hearing all this?
That's a good question. Given how complex sudden hearing loss can be, we still don't always know the exact cause, hence idiopathic, and given the potential but unproven role of hyperbaric oxygen, I think maybe the most critical question for future research is this: can we get better at figuring out the specific underlying reason for the hearing loss in each individual?
So moving beyond just idiopathic.
Exactly, because if we could pinpoint whether it's, say, primarily a circulation issue in one person, or maybe an inflammatory issue in another, or something else entirely, then we could potentially develop much more targeted treatments.
And that would help decide who is most likely to actually benefit from something like hyperbaric oxygen.
Precisely. It might allow us to really personalize the approach, identifying the patients for whom HBOT holds the most promise, and perhaps refining the protocols to match the underlying problem. So understanding the why behind the hearing loss seems key to unlocking the how of effective treatment. It's definitely something worth thinking about, and I'd encourage anyone interested to, look into the sources or seek out more info from trusted medical resources.